New Brunswick Premier Susan Holt says it isn't a surprise. Rural hospitals are overcrowded with patients waiting for space in long-term care homes.
There are more and more people in hospital right now waiting for the supports to return home or the ability to go and receive care in a long-term care facility. And so we will...
According to Horizon Health Network, 40% of its acute care beds are filled by more than 650 people who do not need to be in the hospital. That has led to New Brunswick's government greenlighting Horizon's last resort plan to speed up moving those patients into long-term care homes. For more on what is happening, we are joined by Paula Doucette, president of the New Brunswick Nurses Union. Good morning to you.
Good morning, Lindsay.
40%, when I see that number, that is a huge number. Hospitals in Fredericton, St. John, Waterville, Miramichi are now under what's called critical state admission prioritization status. That's a big title. I mean, what does that mean?
What that means is the patients that are currently in acute care beds within the hospital system get priority to be looked at for the availability of long-term care beds or supports in the communities to return home, rather than looking at those that are in their homes or maybe a level 2 special care home that may require nursing home care. So it really puts a priority and a lens on those that are in the acute care setting right now.
And the issue, of course, is there are not enough beds, correct?
There's not enough beds and there's not enough health human resources. That's the other piece of it. You know, taking these residents from the acute care system and putting them in the long-term care system, where we know right now we are facing shortages there as well with registered nurses, licensed practical nurses, and allied healthcare professionals. So it's really a perfect storm here in the province of New Brunswick that we knew was coming because of our age demographics.
That's what I think, I imagine, is so frustrating for so many people. Like, we know this population is aging. This is a big group of people, and it's only going to get more extreme. What are some of the solutions that you are offering?
Well, we're saying, you know, let's have meaningful conversations. Let's look at all the options that are available to us. Make sure that we have a robust retention and recruitment plan in place so that we can get the appropriate healthcare providers in the appropriate places to care for these folks. You know, if it is in long-term care, what is the outreach for recruiting into those sectors? Also, what are we doing in the hospital system? I know that we always look at the surgeries and the wait times and whatnot, but we really need to look at what are we doing within our hospital system to make sure we're delivering the right care at the right time to the right person.
Because, Paula, I mean, right now, Horizon says some patients are being treated in hospital dining rooms. They're being treated in lounges. You've described what's happening in New Brunswick hospitals as a, quote, moral injury to nurses. So how is all of this affecting the medical care being provided?
Absolutely. When nurses go to work every day, they want to provide the best care that they can to their patients, their clients, and their residents. And when the constraints of not having enough health human resources or the space to do that, they feel that moral injury every day. And it does take its toll because they want to know that they're giving the absolute best care that they can. But when there should be, say, 10 nurses on a unit and there's only 5, you really have to prioritize your time. And then you leave your shift at the end of, 12, 16, and sometimes a 24-hour shift saying, what could I have done better? That takes a toll on a nurse after repeated times of this happening. And we know that that's happening because we've seen an exodus within our profession over the last number of years where nurses have said, I'm burnt out and I'm fed up and I just can't do this anymore, because they want to give better care and they can't.
The province's critical state plan that we were just talking about, that's going to run for what, 30 days? And we're thinking, hundreds of people need beds, need somewhere to go. I mean, what's realistic when we talk about how many people can be welcomed somewhere else?
Yeah, this is really a Bandaid solution. I think the CEO pointed out that the reason for this request was because it's the summer and typically we wouldn't see such high numbers at this time of year. It's more around the holiday season in the winter months. So I think the push to try to alleviate some of those pressures for the summer months, knowing that there is vacation time in place, there are some holidays in there and whatnot, but really to try to to streamline these patients into the appropriate areas so that they receive the right care that they can. Laying in a hospital bed is not how we want to see anybody spend their days. Whether that's in a special care home or a long-term care facility, I think we need to really work together at looking at all the options that are available in New Brunswick to help those patients.
Paula Doucette, president of the New Brunswick Nurses Union, thanks for your time this morning.
Thank you, Lindsay.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.